So healthcare systems in India, the first is National Health Mission. It has two content, the rural and urban. In the rural, there is structures are first is ASA worker, sub center, PSC, and CHA and district hospital. So their basic criteria are these in which you can see. Now, what is the ASA worker? ASA is the accredited social health activist. So criteria for ASA is it should be female, married, age of 20 to 45-year-old, and 10th graduate, has a children more than one and less than two children, a permanent resident of that village. This is the basic criteria for ASA workers. Now is the for the national health for urban. So urban has urban ASA worker. So A&M center and MSC center, urban public health center, urban public community health center, and district hospital. Now this is the types of subcenter and PSC. There's a types of subcenter and PSC. Types of subcenter and PSC. So subcenters are divided into two categories: subcenter A and subcenter B. So A have no there at the subcenter A there is no delivery. Bed 0 to 1. Subcenter B delivery has done and bed is 2 to 3. Now the PSC has a two types of PSC A and PSC 2. A PSC is 24 into 7 functioning if the delivery is less than 20 per month, then it's a PSC A and it has a bed capacity as 4 to 6. Now is the PSC B is the delivery taken place at the PSC more than 20 per month and the bed capacity is 8 to 10. This is called types of PSC and subcenter. Now CSC are the two types is non FRUC or FRUC. FRUC is also known as upgraded CSC, which blood bank plus CSC. Now, is if there is only CSC, there are 30 bed. Urban CSC has 50 to 100 beds. CSC has 50 to 100 beds, and urban CSC approximately 100 beds. Now, bed capacity in this there is a different schemes are present. Now we have seen national health missions. Now is the integrated child development and service scheme, ICDS. It is under the Ministry of Women and Child Development. As what is who's the beneficiaries of ICDS are the four categories. First is children age of 0 to 6 year. Second is pregnant and lactating women. Third is women of reproductive age group 15 to 19, 15 to 49 years, and adolescent females 10 to 19 years. This is the logo of ICDS. This is the logo of ICDS. So now ICDS, what ICDS contain? ICDS contain structure is Anganwadi supervisor, and CDPO is the Child Development Project Officer. So Anganwadi health population of 500 to 800. Anganwadi supervisor has 25,000. Now is CPDO is has 1 lakh population. Now CPDO, what is CPDO? Is the administrative unit. It is an administration unit at the block level. One block have a 1 lakh population. So four Anganwadi supervisor report the one CDPO officer. Now, if we define a mini Anganwadi, what is mini Anganwadi? Only Anganwadi worker, no helper is present. The population is 150 to 300. So, administration unit in the family of health, Ministry of Health and Family Welfare is at district level. At the district level, and what Anganwadi provides? So, what Anganwadi provide? Anganwadi provide a first is supplementary nutrition. So supplementary nutrition, and we what supplement we provide? If there is child, we provide 500 of kilocalorie energy and 12 to 15 gram of protein. If it is a pregnant and lactating female, then it's 600 kilocalorie and 15 to 18 gram proteins. If it's a malnourished child, they will provide 80 in 800 kilocalorie and 20 to 25 gram proteins. So firstly we supplement the nutrition. Firstly we the supplement the nutrition. Second is firstly we supplement the nutrition, and what other functions are? We educate things. Three things education: the non-formal education, adolescence education, and health education. There is three education: non-formal education, adolescent education, and health education. So, and we provide two care. This is the health care and the mother and child care. And we also facilitate immunization with VHNSD. VHNSD is the Village Health Nutrition and Sanitation Day. It's done once in month. So now other scheme is Ayushman Bharat. Ayushman Bharat is component is PMJ is Pradhan Mantri Jan Arogya Yojana, world largest health insurance scheme. There's a 5 lakh to the 10 crore families are included. So per family, the beneficiary, so beneficiaries are 50 crore population. So blanket cover is irrespective of the types of disease. It's irrespective of age and types. The blanket coverage, irrespective of age, type, and disease. So now is the CPH is the Wild Health and Wellness Site Center. Its function is primary health care, a comprehensive primary health care, a continuum of care is diagnostic, therapeutic, and prevention promotion. The time is less than 30 minutes. So we create ABHA ID as a centralized ID for all medical records. Now, now some terminologies is W criteria. For nurse, how 500 population is required. For nurse, 5,000 population per nurse is suggested by Indian norms. So WHO norms say three nurse per thousand populations. Now, if we saw the Indian profile in 2019, there is a 1.21 nurse per thousand populations. So health worker in plain area, there is a one person health worker in 5,000 population. In the hill and tribal area, the one person in 3,000 population. So dai required per village, one trained dai. So pharmacist, one per thousand, 10,000 population. Lab technician, one per 10,000. So ASHA worker, minimum or desirable, the two things. A minimum is one ASHA worker in 1,000 population, and desirable is ASHA worker in 1,000 population. A doctor according to WHO, one doctor in per 1,000 population, and according to Indian norms, 1,445 population have one doctor. Now there is some e-trains programs, e-health and train program. If here is the e-hospital, what is contained? Is what service provided? Hospital record and maintenance and OPD service provided. Now is the e-Sanjeevani. What is e-Sanjeevani? E-Sanjeevani telemedical services. E-Rakt Kos is a blood bank. So other things, M diabetes is diabetes awareness. M suggestion is the quiet smoking. Next year is about TB drug complication and registered TB cases. Next is leprosy drug complications. So now is the training programs. For the training programs, Dakshanta, Dakshanta is the healthcare worker. Dakshata is the healthcare worker. Udisha is the Anganwadi worker. Shaksham is the stimulated advantage occurs there.